Hello, my name is Louise Kelson and I'm a consultant in gynaecology in NHS Lanarkshire. Welcome to the Postmenopausal Bleeding Clinic. We understand that women are busy and multiple appointments can be difficult. At our one-stop clinic, we can speak to you about any worries and concerns that you may have, investigate these, hopefully answer your questions and even offer you a treatment, all in the same day. Postmenopausal bleeding is bleeding that occurs after the menopause. This can happen months, even years after your periods stop. It can be a sign of an underlying abnormality within the womb, but for most patients, there'll be nothing to worry about. When you first come to the clinic, the team will welcome you to the department and take some details. We will have a conversation about the symptoms you have been having. We will then show you into our treatment area. Our clinic room is designed to be private. A member of our specialist nursing team will be there to support you, and although we will do a pelvic examination, you'll be covered from the waist down at all times. The first investigation that we would perform is called a transvaginal ultrasound scan. This involves placing a narrow probe within the vagina. Most women won't find this uncomfortable. This is an internal scan. It gives the best possible view of the lining of the womb. For many women, no further investigation is needed once the scan is complete. If the lining of the womb appears thicker than average, we will offer you a procedure called a hysteroscopy. A hysteroscope is a small camera that passes through the vagina, cervix and into the womb, and it allows us to look inside for polyps, fibroids or any other abnormal growth. It only takes a few moments. During this time, water is passed into the vagina, so you may feel wet and you may experience a period-like cramp. For this reason, we advise you to take simple painkillers before coming, such as paracetamol, brufen, cocodamol, but we also offer analgesia in the clinic, such as topical gels or local anaesthetic. If at any point you feel uncomfortable, worried or sore, we will immediately stop and talk to you about other ways that we can do this investigation. After your investigations, we will give you privacy to dress. We will then invite you to discuss the findings so that we can create a plan that suits you and your needs. Once your examination and treatment has been completed, please feel free to ask any questions that you may have. If you're coming to clinic, please ask somebody that you know and trust to bring you. You may feel shaky after your examination, and it's good to have someone to talk to and to drive you home. Take simple painkillers before your appointment to reduce the risk of discomfort. Finally, if you have a hysteroscopy, you may feel wet or notice blood afterwards, so we recommend you bring a sanitary pad. But if you forget, don't worry, as these are available from clinic. Thank you so much for watching this video and putting your trust in us. We look forward to seeing you at the Postmenopausal Bleeding Clinic in NHS Lanarkshire.